AIDS stands for Acquired Immune Deficiency Syndrome. It is a condition that develops in the later stages of HIV infection when the immune system is severely damaged. It is a serious condition that weakens the body's immune system, making it difficult for the body to fight off infections and diseases that it would normally be able to resist. This makes it hard for the body to fight off infections and diseases. People with AIDS are more susceptible to opportunistic infections and certain types of cancers that rarely affect individuals with healthy immune systems. AIDS is caused by the human immunodeficiency virus, or HIV. HIV is a virus that targets and gradually destroys the immune system, specifically the CD4 cells, which are crucial for immune defense. HIV attacks specific cells in the immune system, making a person vulnerable to a range of illnesses. Without treatment, HIV can progress to AIDS, which is the most severe phase of HIV infection. Understanding AIDS is crucial in today's world. It is important to know how HIV is transmitted, how it can be prevented, and the importance of early testing and treatment. It is a global health issue that requires our attention and action. Millions of people around the world are living with HIV, and many more are at risk of infection. By learning about its causes, symptoms, and prevention methods, we can contribute to a healthier future for everyone. Education and awareness are key in reducing the stigma associated with HIV and AIDS, and in promoting compassionate care and support for those affected. HIV is a type of virus called a retrovirus. It infects and takes over certain cells in the body, primarily a type of white blood cell called a CD4 cell. These cells play a vital role in the immune system's defense against infections. When HIV enters the body, it hijacks these CD4 cells. It uses the cell's own machinery to create copies of itself. These new copies then go on to infect more CD4 cells, gradually weakening the immune system over time. The symptoms of AIDS can vary widely from person to person. This variability makes it crucial to understand the range of possible symptoms and their progression. Some people may experience no symptoms for years, living without any noticeable signs of the infection. This asymptomatic phase can be deceptive, as the virus continues to damage the immune system, while others may develop flu-like symptoms within a few weeks of infection. These initial symptoms are often mistaken for a common cold or flu, making early detection challenging. These early symptoms can include fever, sore throat, rash, swollen lymph nodes, and fatigue. Such symptoms are the body's initial response to the virus and can last for a few days to several weeks. As the immune system weakens, more severe symptoms can appear. This progression can take several years, during which the virus continues to replicate and damage the immune cells. These can include rapid weight loss, persistent diarrhea, severe fungal infections, and certain types of cancer. Opportunistic infections and cancers are common as the immune system becomes increasingly compromised. It's important to note that these symptoms can also be caused by other conditions, so getting tested for HIV is the only way to know for sure. Early testing and diagnosis are essential for managing the disease and improving the quality of life for those affected. With early detection, antiretroviral therapy can be started, which helps in controlling the virus and preventing the progression to AIDS. Regular medical checkups and adherence to treatment can significantly enhance life expectancy and health outcomes. Support from healthcare professionals, counseling, and community support groups can also play a vital role in managing the emotional and psychological impact of the disease. Education and awareness are key in reducing stigma and promoting early testing and treatment. HIV is transmitted through certain bodily fluids including blood, semen, vaginal fluids, and breast milk. It can enter the body through cuts or sores in the skin, as well as through mucous membranes found in the rectum, vagina, penis, and mouth. The most common ways HIV is transmitted are through unprotected sex, sharing needles or syringes, and from mother to child during pregnancy, childbirth, or breastfeeding. It is important to remember that HIV cannot be transmitted through casual contact such as hugging, shaking hands, or sharing food. Section 5. HIV's sneaky attack, the virus at work. Once inside the body, HIV begins its attack on the immune system. It targets CD4 cells, which are white blood cells that play a crucial role in fighting off infections. HIV attaches itself to the surface of these cells and enters them. Once inside, the virus takes over the cell's machinery and forces it to produce copies of itself. These new HIV copies then leave the infected cell and go on to infect other CD4 cells. This process continues, gradually weakening the immune system over time. Section 6. Fighting back treatment options for HIV/AIDS. In this section, we will explore the various treatment options available for managing HIV and improving the quality of life for those affected by the virus. While there is currently no cure for HIV, there are effective treatments available that can help people with the virus live long and healthy lives. These treatments have revolutionized the way we approach HIV care, transforming what was once a fatal diagnosis into a manageable chronic condition. Antiretroviral therapy, or ART, is a combination of medications that work to suppress the virus and prevent it from multiplying. ART is typically a lifelong treatment that requires strict adherence to be effective. The medications used in RT target different stages of the HIV life cycle, making it harder for the virus to replicate and cause damage. ART helps to reduce the amount of HIV in the body, allowing the immune system to recover and become stronger. By lowering the viral load to undetectable levels, ART not only improves the health of the individual, but also reduces the risk of transmitting the virus to others. This reduces the risk of developing AIDS-related illnesses and improves overall health and well-being. Regular monitoring and follow-up care are essential components of successful HIV treatment, ensuring that the medications are working effectively and managing any side effects. With early diagnosis and consistent treatment, people with HIV can live long and fulfilling lives. Advances in medical research continue to improve treatment options, offering hope for even better outcomes in the future. It is important for individuals with HIV to work closely with their healthcare providers to develop a personalized treatment plan that meets their specific needs and circumstances. Section 7. Living with HIV care and support. Living with HIV can be challenging, both physically and emotionally. It's essential for individuals diagnosed with HIV to receive comprehensive care and support. This includes regular medical checkups, adherence to medication, and access to mental health services. Support groups and community organizations play a crucial role in providing emotional support, reducing stigma, and promoting overall well-being. They offer a safe and understanding environment for individuals to share their experiences, access resources, and connect with others facing similar challenges. Section 8. Protecting yourself and others, prevention methods. Preventing HIV transmission is crucial in the fight against the epidemic. By understanding and practicing safe behaviors, we can significantly reduce the spread of the virus. Key prevention methods include practicing abstinence, using condoms consistently and correctly during sexual activity, getting tested regularly for HIV, and avoiding sharing needles or other drug paraphernalia. Additionally, pre-exposure prophylaxis, or PrEP, is a medication that can be taken by HIV-negative individuals at high risk of exposure to prevent infection. Section 9. The future of HIV/AIDS, research and hope. The fight against HIV/AIDS has made significant progress over the years, thanks to advancements in research and medical technology. Scientists and researchers are continuously working towards developing a cure for HIV and improving existing treatment options. Ongoing research focuses on gene therapy, immune-based therapies, and therapeutic vaccines. These innovative approaches hold promising potential for achieving long-term remission or even eradication of the virus. With continued investment in research and global collaboration, we can remain hopeful for a future without AIDS. Section 10. Dispelling myths and fighting stigma. Stigma and discrimination surrounding HIV/AIDS remain significant barriers to prevention, testing, and treatment efforts. It's crucial to combat misinformation and dispel harmful myths about the virus. HIV cannot be transmitted through casual contact, such as sharing utensils, hugging, or using public restrooms. Living with HIV is not a moral failing, and people with HIV deserve compassion, understanding, and support. By promoting accurate information and fostering empathy, we can create a more supportive and inclusive environment for everyone affected by HIV/AIDS. Section 11. Conclusion, a call to action. Understanding AIDS is not just about knowing the facts. It's about taking action. It's about challenging stigma, supporting those affected, and advocating for increased research and access to care. We all have a role to play in the fight against HIV/AIDS. By educating ourselves and others, practicing safe behaviors, supporting organizations working on the front lines, and advocating for policies that promote prevention and treatment, we can contribute to a future where AIDS is no longer a global health threat. Together, we can make a difference.